Hello, my name is Dr. Jereb, and I'm an orthopedic surgeon at Barrington Orthopedic Specialists. I specialize in treating injuries and conditions of the knee. In this video, I will be discussing ACL reconstruction. The anterior cruciate ligament, or ACL, is one of the four major stabilizing ligaments of the knee. It connects the thigh bone to the shin bone of the knee. It is about 30 millimeters in length, and its main function is to provide rotational stability to the knee joint. Most ACL injuries are a near complete or complete tear of the ligament. This means the ligament has been split into two pieces and the knee joint is unstable. The ACL can be injured in a number of ways, such as changing direction rapidly, stopping suddenly where the knee is planted and a twist occurs through the knee, or direct contact through a collision. ACL reconstruction is a surgical procedure that will replace the injured ACL and restore stability and function to the knee. Following an ACL injury and prior to surgery, we focus initially on rehabilitating the knee to restore range of motion. This may take up to a few weeks before normal range of motion is reached and surgery can be performed. When an ACL is torn, it cannot be repaired by attaching the two torn ends back together. It therefore must be reconstructed, which means to make a new one. A graft is what is used as the basic structural component of the new ACL. Grafts can originate from the patient or from a cadaver based on the age of the patient, the extent of the knee injury, and sometimes other factors such as prior knee surgery. At the time of surgery, an arthroscope, which is a small camera, is placed into the knee joint through small incisions in the front of the knee to reconstruct the new ligament. The graft is secured into small tunnels in the thigh bone and shin bone with either screws or heavy gauge suture attached to a small metal button. All other structures will be assessed at the time of the ACL reconstruction, as sometimes meniscus or other cartilage tears can be found. ACL reconstruction may be recommended if you are active, are involved in sports or a job that requires pivoting or twisting, have knees that are unstable, or if you have a combination of injuries. If you are generally healthy, your ACL reconstruction will most likely be performed as an outpatient procedure. This means you will not need to stay overnight at the hospital. Before the procedure, a member of the anesthesia staff will talk with you about anesthesia options. Most ACL reconstruction procedures take about 1 to 2 hours. However, the length of your surgery will depend on what your surgeon finds and what repairs are needed. After surgery, you will stay in the recovery room for 1 to 2 hours before being discharged home. You will need someone to drive you home and stay with you for at least the first night. You can expect some pain and discomfort for at least a week after surgery. If you've had a more extensive surgery, however, it may take several weeks before your pain subsides. Ice will help relieve pain and swelling, and your doctor may prescribe pain medication if needed. Your knee will need to be protected while it heals. You will wear a brace and use crutches for the first few weeks after your surgery. Most patients will begin home exercises within 24 to 48 hours and start formal physical therapy within 1 week after surgery. A movement machine called a CPM is also used in the early postoperative period to regain early range of motion. You may return to your normal activities, including pivoting sports, approximately 6 months after surgery. To learn more about ACL reconstruction, please visit our website. Thank you for choosing Barrington Orthopedic Specialists.